The American Way to Change: How National Service and Volunteers Are Transforming America. Written by Shirley Sagawa. Narrated by Kristin Kalbli.
Chapter 1. Introduction. We're at a pivotal time in America. We face crises in nearly every corner. Whole communities that are stuck in poverty, and middle-class families that are slipping downward. Public schools that don't graduate half of the African American and Latino students who come through their doors. A majority of people of all ages who suffer from obesity and related health problems, and millions of Americans without a place to go for regular health care. Conflict among different religious, ethnic, and other groups, and many Americans uneasy connecting with people unlike themselves. The largest cohort of older adults in history threatening to overwhelm systems of care and outlive their savings. Climate change threatening to wipe away whole cities around the world and make entire species extinct. Many people look to government to solve these problems, but none of these can be solved by government alone. In fact, none can be solved without the committed efforts of the American people, taking action on their own or in concert with others. Service is the American way to change America. Bill Clinton called it that when he proposed AmeriCorps. But service has always been part of America's defining character. From colonial days, when neighbors banded together to fight fires or raise barns, to the victory gardens and civil defense system of World War II, to the swarms of volunteers who descended on New Orleans in the wake of Hurricane Katrina, Americans step up. In recent years, in the face of dire challenges, ordinary citizens seem ready to take action. Applications for AmeriCorps, which engages adults in substantial service in exchange for money for college, tripled in 2009, reaching an all-time high since the program was created. Legislation authorizing the largest expansion of national service since the Great Depression was signed in the first 100 days of the Obama administration with strong bipartisan support. While numbers of volunteers have held steady over the decade, informal volunteering is on the rise, suggesting that more people would serve if only they were asked. The human capital we need to put to our biggest challenges is poised and ready. What would they do? Consider the crisis in education. Qualified professionals in the classroom and leading the schools are absolutely critical to children's ability to succeed. But teachers will be quick to tell you that a child who is disruptive can ruin learning time for the whole class. That a student who misses school due to illness because of childcare responsibilities, or because he doesn't see the point, won't be able to learn. Neither will students in schools where low achievement is the norm, where doing well in class violates unwritten cultural rules. Nor will students who need extra time or extra help that the teacher doesn't have time to give. Government can pay for buildings, books, principals, teachers, and counselors. But something more is needed to solve these complex problems. Volunteers can help by promoting a learning culture, acting as role models, offering one-on-one help, and expanding available services. Or think about health. The public debate about healthcare is really about insurance reform. How we make sure that every person has insurance so they can pay for the medical help they need. But health is about a much broader range of things. It's about preventing diseases through good habits such as eating right and exercising, and avoiding risky behaviors. About disease prevention and managing chronic conditions, and receiving support when challenges arise. Whether they are the loss or illness of a loved one, or an addiction you can't beat on your own. About informed parenting so children get off to a healthy start, and enabling older adults to live independently in their own homes as long as possible, connected to social networks. Volunteers can help with all of these things. True, they can't pay for health insurance for the uninsured, but they can let people know about public health insurance programs and help them sign up. In 2009, there were more than 6 million children who were eligible for health coverage under Medicaid or S-CHIP, State Children's Health Insurance Program, but not enrolled. They can't run a hospital, but they can help patients navigate the healthcare system, translate for people struggling with English, offer a calm
Sample complete. Ready to continue?